Are you ready, Jen?
Yep. I don't have my phone. I don't even want.
One and two.
Mayor, are you ready? All right, we're gonna go live here if everybody's ready.
You want to give us? Well, yeah, you can go live here.
Everybody ready? And we're going live.
It'll modify this, but right now it's focusing on the CSAT. So that's good. Yeah. And then generally, I'll just turn all focus off because, and sometimes it tries to autofocus and it is blurry. It's all in brother. So right now it's on camera one. So when you drop that, clear. When you clear that slide, you don't have to do it. You just click that. But it'll be on this one. Whatever one program is set to. And if there's any, you can just hit the take button and it'll just swap between those two. Yeah, make adjustments if you need to. That's right, yeah, that's right.
Good afternoon. I'm Jennifer Bender with Prairie Lakes Healthcare System, Public Information Officer with the Watertown Area Task Force. This afternoon, up first, we have Mayor Sarah Karen with a community update.
Good afternoon. It's April 8th, 2020. Our COVID numbers in the state are up to 393 with 6 deaths. Cottington County is unchanged with a total of 12 cases. We do have community spread, which means that one or more of the cases in our county cannot be traced to a source. We don't know where they got the virus. We just know that it's somewhere in our community. So someone may be infectious without having any symptoms at all. This is why it's so important to maintain that social distance. You can assume it's you, and please keep your distance at least 6 feet away from everyone else all of the time. I've also had people tell me that they know people who are sick with COVID-19 symptoms, but they are not getting tested because they don't have insurance and they don't feel like they can afford the cost of a doctor visit. Please call the doctor if you are having the COVID symptoms. Everyone who is experiencing the symptoms should be tested. The test is free, and the doctor will work with you to take care of the cost of the visit. The president said on April 3rd, they are taking action to ensure the cost is no barrier to any American seeking testing or treatment of coronavirus. The largest insurer nationwide, Blue Cross Blue Shield, has announced that it will not require any copayment from patients of the virus treatment for the next 60 days, similar to the commitments of Cigna, Humana, and Anthem. He also said hospitals and healthcare providers treating uninsured coronavirus patients will be reimbursed by the federal government using funds from the economic relief package that Congress passed last month. This should alleviate any concern uninsured Americans may have about seeking coronavirus treatment. and that is certainly good news. And one thing I would like to say about masks, save the professional masks for the healthcare workers and first responders. They're kind of in short supply, but everyone can wear the cloth kind. They're very easy to make. I wear one to control a sneeze or a cough that I may have, and it keeps me from touching my face. So I protect you by wearing a mask. If you wear a mask, you protect me. The medical professionals and first responders are also wearing the homemade washable masks on the outside of their medical grade masks so that they can extend the life of their medical grade masks. They're still in short supply. If you're able to sew masks to donate to the healthcare workers, they can be dropped off at the Salvation Army. Thank you for all that you're doing to prevent the spread of the virus. Together, we really are making a difference.
Good afternoon. I'm Lisa Johnson with the Department of Labor and Regulation in Watertown. Just going to go over some frequently asked questions that we get on the phone or online. Right now, South Dakota does not have a waiting week if you file an unemployment insurance claim. You do not have to wait 1 week to get your benefits. The week will be paid. Right now, we're about 3 to 4 weeks out processing and paying the claims, just because we have thousands of claims to process. We get this question, what about this $600? We understand that the federal lawmakers have passed the COVID-19 stimulus bill, expanding unemployment insurance. Once we receive instructions from the federal government, we will make announcement through our website and news releases on how that's going to be processed. If you're an independent contractor, self-employed, business owner, a gig worker, can you apply for benefits now? Not yet. DLR will soon be accepting the Pandemic Unemployment Assistance, PUA, a provision of the CARES Act signed into law. Again, we are just waiting on that. For daycare individuals, if someone with an at-home daycare was not eligible for regular benefits, they may be eligible for this new PUA, and just keep watching for that information. At this point, individuals do not have to look for work. Due to the governor's declared state of emergency, job contacts are not required at this time. You will be notified once you are required to start looking for work again. To file for benefits, if you have not filed for benefits, if you've been recently laid off, or you're being reduced hours, you may go to raclaims.sd.gov, or you can call 626-3179. If you have filed unemployment and you're currently wanting to get the weekly request for payment, you need to call this on Sundays preceding the week that you want to get paid for by calling 626-3212. A lot of people have this question: will Social Security or retirement benefits have an impact on my claim? No, they will not. Social Security or retirement benefits do not need to be reported and will not reduce benefits. Direct deposit is very easy to do, and so we're asking individuals, instead of getting a debit card, which automatically comes, that you can go in on your unemployment insurance benefits and sign up for direct deposit. It's very easy to do that as well. Just be aware, if you want to cancel your claim for any reason, let's say you're going back to work and you do not want to keep filing, you can just send an email to cancelra@state.sd.us. If individuals are currently working a full-time job and maybe they get laid off from their part-time job, unfortunately, they're not eligible for unemployment because they still have a full-time job. So we get that question a lot as well. If you're working full-time and you lose your part-time job, unfortunately, you still have a full-time job, so you would not be eligible for any benefits. For employers, if you are having individuals that are being laid off, we do encourage you to use the SIDES program. It's called the State Information Data Exchange. It's fast and secure. Once an employer signs up for this, you can email the claim information and not mailed. It is very fast for your employees then to get that information back. And to sign up, dlr.sd.gov/RA/businesses/sides.aspx, and we'll have this information on the Facebook page as well. Thank you.
Thank you, Mayor Karen and Lisa. So a few more notes for the community on a couple of projects and things happening. The first is in regards to blood supply in the community. So as COVID-19 is keeping people at home, the need for blood donations is more vital than ever. The Community Blood Bank is the sole provider of blood to Prairie Lakes Healthcare System, and our supply is low. We do have 3 opportunities coming up to donate blood in our community for those who are feeling well. The first is on Monday, April 13th, at outside of Prairie Lakes Specialty Clinic and the Blood Mobile from 8 a.m. to 10:30 a.m. and noon to 3 p.m. Now, with the COVID pandemic going on, we are asking for appointments only, and you can sign up for an appointment at prairielakes.com or by calling 882-7908. Now, there is also 2 other opportunities on April 16th of next week. One is being hosted outside Montgomery's from 9 a.m. to 1 p.m. and 2:30 p.m. to 5 p.m. And the second is at the Salvation Army from 9 a.m. to 1 p.m. and 2:30 p.m. to 5 p.m. So the same times, just 2 different locations on April 16th. You can sign up for that blood drive by visiting cbblifeblood.org, and that link will be below this post here on Facebook. Or you can call 877-877-3070. So blood donors must be at least 17 years old or 16 with a signed parent consent form, weigh 110 pounds or more, and be in good general health. That is very important right now with the current pandemic going on. Donors exhibiting any symptoms like cold or flu symptoms are unable to donate. A valid ID is required, and it's recommended that you eat and drink plenty before donating blood. So again, it's an appointment-only blood drives happening next week on the 13th and the 16th, and more details will be posted on the Facebook page. Secondly, a reminder about the current project we have asking the community members to donate masks. Thank you to everyone who is graciously sewing these masks that are going to be for healthcare workers and first responders. These masks can be made of cotton or cotton blend material like a t-shirt, and if you do not have elastic available at this time to make the ties, you can use fabric. I've also heard of people using yarn, and make sure if it's not elastic to have it so it ties in the back. If you do have some completed, we are asking you to please drop those off as soon as you are able at the Salvation Army, Monday through Friday, 9 a.m. to 5 p.m., and the address is 621 4th Street Southeast. So the masks will be donated first to healthcare workers and first responders through the Watertown Area Task Force. Currently, they are not available for the public to pick up from the Salvation Army. So, are there any questions from the media? No questions today?
No questions.
All right, thank you. And thank you everyone for joining in today. Have a great evening.